Hello guys, and welcome to the tutorial video of two psychiatric disorders that we're going to discuss in today's videos. That is the first one being schizophrenia and the second one that is mood depressive disorder. So we're gonna discuss both of the psychiatric disorders in detail. When I mention in detail, the things that I would like to include is firstly what is schizophrenia, secondly the signs and symptoms that are present in this disease, uh, the signs and symptoms that are present in this disease. The third one would be the different factors that are involved that causes this disease to worsen or to lessen. So let's get going. Firstly, we'll discuss about what is schizophrenia. So, schizophrenia is basically a mental disorder that is characterized by significant alterations in the perception, thoughts, mood, and behavior. The symptoms that are described in this following psychiatric disease are in terms of positive, negative, and cognitive symptoms. The positive symptoms, when I mean the positive symptoms of schizophrenia, what I would like to discuss would be it would be the same for any psychosis. And when I mention negative psychosis, it would mean it is for different psychiatric disease. Psychosis is noted for the first time in a person who is later diagnosed with schizophrenia is referred to as first episode psychosis, meaning when this incident happens for the first time in a schizophrenic patient, when the symptoms start to appear, it is called as a first episode psychosis. Now let's get along with the different kinds of symptoms. Firstly, let's begin with positive symptoms. Positive symptoms are those symptoms that are not normally experienced but are present in people during a psychotic episode in schizophrenia. They include delusions, hallucinations, and disorganized thoughts and speech, meaning the person suffering from schizophrenia generally sees or listens to things that are not actually present, in the reality. So that is called what we call as a delusion or a hallucination. Hallucination most commonly involves the sense of hearing. That is called as an audio hallucination, which involves hearing voices that are not actually present, but sometimes can involve any senses, including taste, sight, and touch. Uh, okay, so they are also typically related to the content of the delusional theme. Delusions are bizarre or persecutory in nature. Distortions of self experience, such as feeling as if one's thoughts or feelings are not really one's own, meaning the schizophrenic patients generally complain about there's a voice in their head that they can hear telling them to do something. For example, most of the schizophrenic patients they suffer from um uh, deathly, meaning a voice in the head tells them to kill themselves. So yeah. So the positive symptoms are generally thought to be well responded by medication. So now let's get along with the negative symptoms. The negative symptoms are characterized as deflects of normal emotional responses or of further thoughts processes. Meaning, the five recognized domains of negative symptoms are blunted affect, meaning showing flat expression or little emotion. Meaning, the schizophrenic patient fails to show any sort of expression, no matter how he feels on the inside. Second one is the allogia, a poverty of speech, inability to express themselves because of the of fear. The third one would be anhedonia, meaning an inability to feel pressure. The person is numb to literally anything. The fourth one would be asociality, the lack of desire to form relationships. As I said, as the person is numb to any sort of feeling, he or she does not express the interest in order to get into any sort of relationships. The fifth one would be evaluation. meaning a lack of motivation and apathy because obviously of the lack of feelings. The other related symptoms are social withdrawal, meaning lack of hygiene, self care, and loss of judgment because of the loss of interest in maintaining relationships. Let's get on with cognitive symptoms. Cognitive defects are the earliest and most constantly found symptoms in schizophrenia. They are core features but not considered to be core symptoms, as are positive and negative symptoms. Meaning, these symptoms are not as effective or as, let's just say, as common as the positive and negative effects. Now, let's talk about the onset of schizophrenia. Uh, the schizophrenia is generally first observed in the late adolescent period and early adulthood, that is between, let's just say, 18 to 21, because that would be the peak or the downfall of adolescence and the uprising of the adulthood. The causes. There are a list of causes, and let us discuss about them. The first one is genetic. It is estimated that schizophrenia in 80% of the schizophrenic patients, it is estimated that it is genetic. The environmental factors that include are oxygen deprivation, infection, prenatal maternal stress, and malnutrition in the mother during fetal development. So these are some of the environmental factors that would lead in schizophrenia. Also, the hormonal dysregulations such as the dopamine and serotonin pathways would also inflict with this matter. Also, substance abuse such as cannabis use, nicotine, excess alcohol intake, or some of the substance abuses that might contribute to schizophrenia. That because these substance use causes such as depression, anxiety, boredom, and loneliness. Also, the use of tobacco that comes under substance abuse mechanisms. So, the mechanisms of schizophrenia are unknown, and a number of models have been put forward. They are very there are a huge number of theories that explain why schizophrenia is indeed happening, but there is no pinpoint explanation to schizophrenia because all the psychiatric disorders are like that. Now let's get along with the diagnosis. There is no specific diagnosis for schizophrenia like there would be of any psychiatric disorder. Psychosis. Psychosis is the one that plays an important role in schizophrenia. Like we just discussed about the first episode of psychosis. When it appears, then it might be a symptom that the person has psychosis, and yeah, that's it. Let's get along with the medications. The medications involved any sort of medication that has anti-anxiety, antidepressant, and other sort of therapies that bring the patient back to his senses. Get along with the family, with the others that are beside him. So yeah.